you'd like to speak, please raise your hand, and then we're going to go in order of who raised their hand. Please provide your name and your organization if that's applicable. You can also give a comment in the chat function, and we'll try to respond to those, but we are going to direct comments to grantsupport@cityofchicago.org. I'll have that up on the screen in a minute here, but that is where we are going to accept public comments, and those comments will be included in our final submission to Housing and Urban Development for the consolidated plan. Going on to the next slide. So as a result of the Coronavirus Aid, Relief, and Economic Security Act, the CARES Act, the City of Chicago received $72 million in additional federal grant funding from the United States Department of Housing and Urban Development to provide assistance for the response and recovery efforts as a result of the coronavirus COVID-19 pandemic. While this is an important source of funding from the federal government, please note that it does not represent the total investment the City of Chicago has in response to the COVID-19 pandemic. The purpose of tonight's hearing is to give you an opportunity to provide input on the programs recommended to receive this funding. The purpose of these grant programs is to provide funding for housing, community development, and public services programs in order to respond to, prepare for, and prevent outbreaks of infectious disease. So here's the amounts that are that have become available to the City of Chicago due to the CARES Act. So it's broken up as $46.7 million for the Community Development Block Grant, $23.7 million for the Emergency Solutions Grant, and $1.5 million for the Housing Opportunities for People with AIDS Grant. All right, so I'm going to quickly go over some of the programs, but then the departments that are on hand as panelists are going to go into them and describe the programmatic features of those programs. So the total investments here in the Community Development Block Grant, as I said, was $46.7 million. That's broken up into $11 million in community healthcare infrastructure investment, $10 million in violence prevention investment, $10 million in mental health services investment, $7.4 million in homeless services investment, $4.5 million in workforce services, $1.57 million in home delivered meals, $1.56 million in food assistance for at-risk populations, $555,000 for food assistance for farmers markets, and $207,000 for domestic violence. So as I said before, I'm gonna kick it off to our panelists, and once after we kick it off to the panelists, we're gonna open it up to the public to provide comments. So with that, I'm going to kick it off to the Department of Family and Support Services. Let me see here. Elisa.
Yeah, so good morning. I am Elisa Rodriguez, Managing Deputy Commissioner for the Department of Family and Support Services. Under the substantial amendment to the City of Chicago's 2020 Consolidated Plan, DFSS will receive funding to support two programs, the Community Development Block Grant, CDBG, for approximately $12.3 million, and the ESG Solutions Grant, ESG, for $23.7 million. The CDBG Corona's funding will support 5 DFSS divisions. These include the Homeless Services Division, Workforce Services, Senior Services, Human Services, and the Division on Domestic Violence. Under Homeless Services, DFSS is receiving $7.4 million for 3 key projects. These include homeless shelter, with the purpose of supporting decompression of shelters to follow Centers for Disease Control and Prevention social distancing requirements, specifically costs for short-term operation of temporary shelters at the following sites. Funding will support 799 beds at the Rauner YMCA, the McCormick YMCA, Salvation Army Harbor Light, Calumet High School, and the Broadway Armory. This funding will also support homeless drop-in centers for approximately $388,000. Funding will increase the number of staff providing case management at these locations, client supports, which include transportation, clothing, and other services, as well as food. Funding for this will support approximately 1,000 households, sorry. Funding will also support homeless outreach for approximately $247,000. This will increase staffing to support housing navigation, Client supports, again, to include PPE, transportation, clothing, and other services, hazard pay for mobile crisis and shelter referral outreach activities, and we anticipate supporting 1,000 residents with this. Under workforce services, DFSS is receiving $4.4 million for workforce support to serve additional job seekers. This will assist in meeting the demand of individuals seeking to become gainfully employed. The DFSS Workforce Division is seeking additional funding to support currently funded CDBG workforce agencies that work with Chicago's most vulnerable populations. These include those limited in English proficiency, experiencing and or at risk of homelessness, and returning citizens. The additional funding will be used to assist job seekers impacted by the COVID-19 pandemic through workforce development programs. Workforce development programming is provided to job seekers through 4 program models: employment preparation and placement, industry-specific training programs, transitional job programs, and reentry support centers. DFSS estimates that 2,000 persons will be served with this funding. Under senior services, home delivered meals will receive $1.5 million for home delivered meals for older adults. The HDM program provides nutritional meals to older persons aged 60 and older in the city of Chicago who are frail and homebound because of illness, incapacity, disability, or isolated. The HDM program is designed to promote the general health and well-being of older adults by reducing hunger and food insecurity and delaying the onset of adverse health conditions that lead to premature nursing home placements. With the implementation of the stay-at-home order as a result of the spread of COVID-19 virus, over 4,000 new clients have been added to the HDM program since March 16, 2020. This is an increase of more than 60% from the period before the outbreak. DFSS estimates that 1,114 persons will be served with this funding. Under Human Services for Emergency Food Program, DFSS proposed $1.57 million to provide emergency food assistance for at-risk populations. Funding will provide emergency food assistance for at-risk populations and increase the availability and accessibility of healthy and fresh food options for those economically impacted by COVID-19. This initiative will be facilitated in partnership with the Chicago Food Depository through an established network of approximately 100 food pantries located throughout the city of Chicago, within a 5-mile radius of our 6 community service centers and locations concentrated in food insecure areas. An additional 70 homeless and domestic violence shelters will receive fresh fruits and vegetables. DFSS estimates that 138,980 persons will be served with this funding. Under the Division of Domestic Violence, DFSS will receive $207,000 to support the Illinois Domestic Hotline. The Illinois Domestic Hotline operates 24/7 and provides calls and text messages with crisis counseling, safety planning, DV shelter and service referrals, as well as other services. During COVID-19, calls to the DV hotline increased and is expected to result in an additional 3,000 calls and texts per year. The strain on the DV hotline has resulted in an increased staff hours and need for additional training for victim information referral advocates known as VERAs, both during and post-COVID to respond to the challenging needs of domestic violence victims. The stay-at-home order and economic instability for loss of income has caused extreme stress on vulnerable households, driving the need for additional VERAs on hand to answer calls and texts. The increase is expected to continue as victims attempt to return to employment. In addition to the increased demand of VERA's personnel, the hotline staff will need to be trained on post-COVID resources and referrals. DFS estimates that 3,000 persons will be served with this funding. The funding will also support activities such as additional personnel costs to provide COVID and post-COVID services to callers of the DV hotline, training and technical assistance for the VERAs responsible for assisting hotline victims during this pandemic, and promotional materials and supplies and equipment to ensure unhindered access to the DV hotline Vera services. In addition to the CDBG grant, DFSS will also receive Emergency Solutions Grant, ESG, for $23.7 million. The ESG funding will support 4 homeless projects and activities that mitigate the impact of COVID-19. These include within the Homeless Services divisions. ESG provides funding to engage homeless individuals and families living on the street, improve the number and quality of emergency shelters for homeless individuals and families, help operate these shelters, provide essential services to shelter residents, rapidly rehouse homeless individuals and families, and prevent families and individuals from becoming homeless. The projects include the following: housing assistance to prevent homelessness for $5.38 million, housing assistance for decongregating shelters, rapid rehousing, $15.6 million, homeless management and information system, HMIS, $300,000, homeless shelters, $702,000, and admin costs for $1.6. Under homeless prevention, the funding will support rental assistance for residents economically impacted by COVID-19 and as a result are at risk of becoming homeless. Staffing increase along with increased staff at the Homeless Prevention Call Center and creating a pilot diversion team. DFSS has seen an increase in calls to the Homeless Prevention Call Center, the central point of access for homeless prevention funds. So far, the volume of calls has increased by 50% this April compared to last year. Average wait time has increased from 69 minutes in January 2020 to over 130 minutes in April of 2020. Call center staff conduct a brief intake and refer calls to prevention agencies and community service centers across the city. Under rapid rehousing, this will support rental subsidies, case management, and housing navigation services, as well as move-in fees to house 1,250 households. Funds will support the Expedited Housing Initiative, also known as EHI, developed in coordination and collaboration with the Chicago Continuum. EHI utilizes housing as an effective public health intervention to ensure homeless Chicagoans at risk of serious illness due to COVID-19 can maintain their health in their own home. Under Homeless Management Information System, HMIS, the $300,000 investment will support administrative support for additional HMIS users, the tracking of outcomes of COVID-19 response, and related technical assistance with HMIS. As you know, DFSS opened temporary shelters to decompress the current shelter system. These facilities need assistance in using HMIS and tracking the data and outcomes of COVID response. In addition, our current homeless providers will need technical assistance in capturing data and outcomes of the COVID-19 response. Under shelter, $702,000 will support staffing, supplies, operational costs for shelters to sustain a decompressed shelter system to follow the Center for Disease Control and Prevention social distancing requirements. Administration, $1.6 million will fund administrative costs for the rental assistance program as well as the rapid rehousing programs. Thank you.
All right, now we're going to kick it off to Ayanna Thomas with the Chicago Department of Public Health.
Hi, this is Ayanna Thomas. I'm the Supervisor of Grants Administration for the Chicago Department of Public Health. We're requesting $10 million in violence prevention dollars for expanded street outreach. Emerging data suggests that many of the communities in Chicago that are experiencing the highest levels of interpersonal and structural violence are also disproportionately suffering high rates of COVID transmission and especially COVID-involved deaths. This funding would fill identified gaps in communities with existing street outreach infrastructure and allow the launch of new street outreach programs in identified high-need communities without current infrastructure. Given that violence like COVID is plaguing specific communities, Chicago seeks to enable its hyperlocal violence prevention partners to extend existing street outreach focused violence reduction efforts to now include sharing, modeling, and supporting their neighbors and community in COVID prevention actions as well. This project will serve approximately 1,575 persons in 15 community areas across the city of Chicago. Next, we're requesting $10 million in mental health services, COVID-related mental health services. We are proposing funding building outpatient mental health services in communities highly impacted by COVID, which would fund a network of 15 public and nonprofit care centers that would be selected via RFP to expand mental health care to those most impacted by COVID-19. We're also proposing $1 million in ACT CST services for serious mental illness. There is a citywide need to urgently support community-based mental health treatment services for persons living with serious mental illness and co-occurring disorders. This program will assist 150 to 200 persons per year with complex needs not effectively addressed by other less intensive care models. $2 million to building community connections and healing across Chicago to improve community mental health. We will fund up to 40 community and neighborhood level projects that promote community building, social connection, and healing in communities most impacted by COVID-19. Each grant will contain a planning component in which community members conceive and design a project or campaign that builds or supports community and promotes healing. This program will assist an estimated 5,000 persons. Suicide prevention for $1 million. We'll fund a coordinated citywide suicide prevention strategy that will build citywide awareness about suicide prevention and risk, increase suicide screening across multiple sectors and settings, and fund evidence-based suicide prevention interventions across multiple sectors and settings that serve persons at highest risk of suicide. This program will assist an estimated 3,000 persons. Community mental health workers at $1.5 million. These funds will establish a program to build, train, and support a network of community health workers to promote mental and emotional health and healing among persons most impacted by COVID-19. Community mental health workers will build awareness of healing resources, facilitate connections to needed resources, and convene community-level conversations about healing and community well-being. This program will assist an estimated 5,000 persons. Behavioral health services for homeless shelters, $500,000. These funds behavioral health teams to provide behavioral health services at homeless shelters across Chicago. A combination of telehealth and in-person services will be utilized to provide psychiatric and psychosocial assessment, medication consultation, and medication-assisted treatment to persons experiencing homelessness within Chicago's shelter system. The Chicago Department of Public Health is also requesting approximately $555,000 for our Link Up Illinois Link Match program. COVID-19 has increased food insecurity and shined a spotlight on racial disparities in chronic diseases, which are in part impacted by nutrition. More than 60% of Chicago residents cite affordability as a key barrier to healthy eating. Likewise, even before job losses associated with COVID-19, more than 50% of Chicagoans in some neighborhoods were at risk of food insecurity. This program will provide farmers market funding for Link Match for Link card shoppers, along with training and technical assistance to support implementing these programs successfully through the Chicago-based nonprofit and sole source provider Experimental Station. While all farmers markets serving Link card shoppers throughout the city will be eligible, the focus of this program is on equity to increase availability, accessibility, and affordability of healthy food for Black and Latinx residents. This project will serve approximately 6,500 plus families or 18,000 residents. Additional anticipated outcomes include increased access to and consumption of fruits and vegetables, which support good health. Oh. Housing opportunities for persons with AIDS, the HOPWA program, $1.5 million in allocation to provide housing assistance and related supportive services for low-income persons with HIV/AIDS and their families. We're proposing operating costs of housing facilities at $300,000. We anticipate serving 1,700 clients indirectly, with 19 delegate agencies involved. There will be $500,000 in additional supportive services, anticipating to serve 500 clients throughout the Chicago EMSA, and roughly $700,000 in hotel room isolation leases, which is a new service category. AIDS Foundation of Chicago will be coordinating those efforts, and we anticipate serving 30 COVID-19 isolation and 50 awaiting clients for permanent housing. And that will be throughout the Chicago EMSA. Additionally, there will be approximately $46,000 in administration costs.
Thank you, Ayana. Next, we're moving on to the Department of Planning and Development. And we have James Harbin here from that department to give a presentation on what the programs to be funded from CDBG are. James?
Yes, thank you. And good morning, all. This is Jim Harbin, Deputy Commissioner for the Department of Planning and Development. And I'm pleased to address the department's portion of the Chicago CARES Act funding. The total amount of $11 million will be allocated for the development of 2 public healthcare projects in underserved communities. Both projects are grant winners through the Pritzker Trabert Foundation's Chicago Prize, which endeavors to build a better economic future for Chicago's South and West Sides. The first project is the Auburn Gresham Healthy Lifestyle Hub, located at 839 West 79th Street. The $12.4 million project by the Greater Auburn Gresham Development Corporation will renovate a long vacant, highly visible building into a community hub that will free up hospital capacity and provide healthcare options to residents. The CDBG funding request for this project is $4 million. As of June 2nd, approximately 1,000 COVID-19 cases were recorded in the zip code. The proposed project includes a federally qualified healthcare center that serves 8,000 annual patients, which will include 19 exam rooms, 8 dental chairs, 2 behavioral suites, and a laboratory. Also included in the project is a minority-owned pharmacy, a restaurant, government offices, educational services, a business incubator, business development center, housing agencies, computer literacy services, job training and placement services, and co-working and community spaces. According to the U.S. Department of Housing and Urban Development, the project is eligible for CBDG to construct a facility for testing, diagnosis, or treatment, or to rehabilitate a community facility to establish an infectious disease treatment clinic. The project location is a vacant 4-story building along 79th Street that is being targeted for revitalization through Mayor Lightfoot's Invest South and West initiative. The second project is the North Lawndale Surgical and Ambulatory Care Center. It is located at 2600 on the 2600 block of West Ogden Avenue. The $12.3 million project, by Mount Sinai Hospital will address health-related needs of North Lawndale and bridge the gap between clinical and community services. The CDBG funding request for this project is $7 million. As of June 3rd, the zip code 60623 had more than 3,000 COVID cases, the most in the state. The funding will support construction of a 30,000 square foot surgical center, the first of 4 planned buildings in the complex. The surgical center is a direct response to Mount Sinai Hospital's 2019 Community Health Needs Assessment, which will reduce healthcare disparities for residents where residents live and raise families. The ambulatory surgery is prioritized as the setting is safer than a hospital and creates a new standard for outpatient care. Additional priorities will include renal dialysis and digestive health. The building will also include commercial and retail spaces, including restaurants and a bank branch with local hiring commitments. The facility will help respond to COVID-19 impacts and other infectious diseases. The site is vacant. It was previously used for CHA and commercial activities. According to the U.S. Department of Housing and Urban Development, the project is eligible for CBDG to construct a facility for testing, diagnosis, or treatment, or to rehabilitate community facility to establish an infectious disease treatment center. Thank you.
Okay, so we are going to allow the next half hour to be for public comments. Public comments, because there are a lot of people on the line, please limit to 2 minutes and on this substantial amendment. So we're going to allow for the 2 minutes. Please don't make me cut you off. Please click the raise your hand function if you'd like to speak, and I will go in order and I will say the name and then click unmute. Please provide your name and the organization if that is applicable. Additionally, I have been seeing a lot of comments in the question and answer function. Please submit comments to grantsupport@cityofchicago.org. That's grantsupport@cityofchicago.org. I'm going to leave this screen up during public comments. You can also find our presentation after this. The presentation will be available at www.chicago.gov/OBM. So that's /OBM. With that said, the other thing that I am seeing is people are asking a lot about the investment here. Please note that this is only the HUD investment of federal funds. We are investing money elsewhere through different funding sources, but this is particular to the HUD investment for the entitlement grants. So again, please click the raise your hand function and I will start opening it up. All right, so first is Evan Lyon. I am going to click unmute. Evan?
Can you hear me now?
Yes, I can.
Okay, great. Thank you. So my name is Evan Lyon. I'm the Chief Medical Officer for Heartland Alliance Health, the homeless healthcare provider for the city. I'm going to speak quickly with the 2 minutes we have. First, I want to commend everyone for partially funding the expedited housing initiative. This, will create, we believe, 1,250 more units out of the 1,750 proposed. As we know, homelessness remains a very, very large issue in the city, with 77,000 people homeless by the HRSA definition of unstably housed. We would advocate as homeless healthcare providers for increasing opportunity to house the additional 500 households that really are in need, perhaps in a legitimate way, more than ever. We've also learned over the last number of months working together with partners across the city that improved care at homeless shelters and throughout the system, continuing up to housing, is life-saving. There were substantial outbreaks of COVID infection in congregate settings. Those, thanks to efforts through the city and partners, are in a calmer place, but we know that risk remains. Housing is the real answer to that risk, but in the interim, continued vigilance, both for our homeless neighbors here in the city, but also, frankly, for all of us, right? If someone's sick, anyone might be sick, and homeless lives are often lived in public. And so continued investment in housing, continued investment in shelter-based primary care, behavioral health, and work to continue to try to contain this novel coronavirus it's been an exciting bit of work and needs very crucially to continue.
Evan, thank you so much. If you would like, could you please also submit a comment to grantsupport@cityofchicago.org, a written comment?
Absolutely.
All right, we appreciate it. Thank you so much. Next I have is Velma Jackson. Velma, you should be unmuted.
Can you hear me now?
Yes, I can.
Okay, my comment is regarding shelter for the home. We spent a lot on solutions. Why don't we go
Velma, I'm sorry, you're breaking up.
switch to like a permanent, more permanent? Can you hear me now?
Yes.
Okay. Why don't we find more of the SROs, the single room occupancy that was in place when I first moved here, like 20 years ago. Now we have a lot of businesses, factories that have been, that can be retrofitted. The occupancy, the single room, service provisions, and other programs that would sort of, give create a home spot for them rather than just where it's 6 months, you go through some service and then out you go with nowhere else, there's nowhere else for them to go.
Velma, thank you very much for your comment. It is breaking up quite a bit. If you could please submit a written comment to grantsupport@cityofchicago.org, we will put it down in our substantial amendment and it will be included in our submission to HUD. But you were breaking up, so I would love to see a comment from you to grantsupport@cityofchicago.org. Thank you.
Thank you.
All right, next I have Emily. Emily, you should be unmuted.
Okay, can you hear me?
Yes.
Great. Hi, my name is Emily Robinson, and I work for Elevate Energy. And we are a delegate agency for the small accessibility repairs for seniors program under the Department of Housing. And first of all, just wanted to thank you for providing this opportunity to review your ideas. The one comment I have is that my understanding was that this is emergency funding to respond to this unprecedented emergency with the coronavirus. And while some of the ideas seem to directly assist people that are hurting now and are in crisis now, there are some other ideas, such as the laudable idea of having the community health center that seems like a great idea under normal circumstances, but would take some time before it actually reaps benefits for the citizens it's trying to help, when many of those are in need right now and need help from the city right now. Also, I noticed that there's nearly $30 million with both the ESG and the CDBG funds directed toward homelessness prevention and addressing homelessness, which is, again, totally laudable, but I'm surprised that there's not more additional funding for preventing homelessness. For instance, it's odd to me that the Department of Housing isn't even part of this hearing. I, as a delegate agency for the Department of Housing, we weren't asked to comment or provide some of these ideas to contribute to the amendment. And specifically given that in April, 80,000 people applied for rental assistance for the 2,000 spots that were made available by the city. It's really surprising to me that funds weren't made available for that. So again, thank you for all, putting great thinking toward this, but there are just some additional missing ideas and some ideas that seem maybe not appropriate for this time. So thank you.
Emily, thank you so much for your comment. I did get an email from you this morning that we are going to be responding to shortly. And we really do appreciate it. I will stress again that this is not the full investment of the city of Chicago to combat coronavirus. So with that, I'm gonna see, is there anybody else that would like to speak? It looks like I don't have any raised hands. Oh, I got one, okay. Kay Peterson, I am clicking allow to talk. Kay Peterson? Hello? Okay, looks like you're still on mute on your side. Would anybody else like to comment? I don't have any other hands raised at the moment. We do have 20 minutes. Adam Ballard, I am clicking allow to talk. Adam?
Yes, hello, can you hear me?
Yes.
Good morning, everyone. This is Adam Ballard from Access Living. We'll be submitting written comments as well. But I just wanted to bring a couple things. One thing I put in the chat, and I appreciate the response. But I think it's important to keep in mind that these plans, and I understand they aren't the complete set of plans yet, but or the complete disbursement of these funds, but we really need to address the issue of disabled folks living in nursing homes. Nearly half, in some counts, over half of all the deaths nationwide have been tied back to nursing homes, either people who live there or staff. They're the actual, they're the nerve center, I guess, of the worst of the virus right now, and we need to get people out, get people into their own homes, and there's an opportunity here to use some of these funds to do that. The disability community, Access Living, is standing by, ready and willing to help move people in to units out of nursing homes. So I just wanted to bring that up. And also, disabled people are also disproportionately represented in the homeless population. So we do support the existing efforts in this funding to decongregate homeless shelters and get people off the streets, out of encampments. We need to increase those efforts and again, make sure that when people are being moved off the streets or out of shelters or encampments that have disabilities, that we're doing so in a way that accommodates their disability and moves them into units that will be accessible to them. Thank you.
Adam, thank you very much for your comment. You are going to be submitting a comment via grantsupport@cityofchicago.org, right?
Correct.
Okay, thank you so much. I do appreciate that. With that, I'm going to try for Kay Peterson again. Kay Peterson? Okay. Velma Jackson.
Okay, one other comment. Can you hear me now?
Yes.
Okay. Under your domestic fire, use some training.
Velma, I'm losing you again, so I'm gonna go ahead and put this on mute, and we will.
I thought that the police. Okay, thank you.
All right. Does anybody else
Okay, thank you.
Does anybody else have a comment? Okay, I'm gonna give it about 30 seconds for anybody else to click the raise hand function. Oh, I have some. Okay. MBOGARD. You are unmuted.
Hear me?
Okay, we can hear you now.
Okay, I have so I got on kind of late. So I just have a clarifying question. This is for the HUD housing grant, not for after school summer enrichment portion of the CDBG grant, correct?
This is for the community development block grant. I think that what you might be thinking of is the community services block grant, which is a different.
Okay. Okay, all right, thank you.
Okay, thank you. Okay, I was missing a few. So Andrew Winter. Andrew, you are unmuted.
Good morning, Andrew Winter from Cornerstone Community Outreach. We're a provider of shelter for people experiencing homelessness on the north side We're a partner of the Chicago Homeless and Health Response Group for Equity. There used to be the West Side COVID response group that really stepped up with multiple city departments, including public health and family support services, to really address the issues of COVID. We're grateful for the allocations of funding that are being provided here. And I, as a shelter provider, would speak on behalf of those that we're serving, saying the more that can be invested in the facilities that are existing, be it the ongoing costs or any kind of facility upgrades to decrease the spread of infection is important to us. Grateful for the work the city is doing, and grateful for all the commissioners and managing commissioners that have been so engaged in this process. So thank you, and appreciate the work being done.
Andrew, thank you so much for your comment. If you would like, could you please submit a written comment to grantsupport@cityofchicago.org?
Will do.
All right, thank you. I appreciate it. All right, it looks like we have F. Rodriguez. I'm clicking allow to talk.
Good morning. Can you hear me?
Yes.
Hi. So I just need some sort of clarification in regards to who exactly would be eligible to receive these types of funds. I'm part of the organization Mujeres Latinas en Acción, and most of our clients kind of overlap. We have undocumented women who cannot leave their homes from their abusers because they cannot afford to housing outside of their original home. So I was just wondering, is there somehow kept in mind the undocumented population, whether they can apply for insurance because they're underinsured, or is there a grant available for them when they need assistance? Because many of the hotspots are in populations where there are a lot of minorities and they are undocumented. So I feel like there's it wasn't really addressed. So I don't know if you can offer a clarification if undocumented people would be eligible for these programs. Thank you.
Thank you for your comment. So if you email grantsupport@cityofchicago.org, we will get back to you on that question, okay?
Okay, thank you.
Thank you. Anybody else? I still have Kay Peterson unmuted, but I have not heard anything. Does anybody else want to speak? I do not have any more hands up. Okay, well, if nobody else would like to speak, this will conclude our public comments. If you wish to give your contact information, please send to grantsupport@cityofchicago.org. I'm going to say it a few more times. That's grantsupport@cityofchicago.org. You can also view this PowerPoint, and the presentation should be available in the next few days on www.chicago.gov/OBM, and you will then click on Grants and Consolidated Plan, and that it has everything that is related to this grant. It's all in one place. It's at cityofchicago.gov/OBM. If nobody else has anything to say, we thank you so much for participating here, and we look forward to working with everybody, and we look forward to seeing your comments at grantsupport@cityofchicago.org. So with that, I am going to end this call. Thank you all so much.